Conducting an examination performer. An examination of a trauma patient is different from an examination of a medical patient. When conducting an exam, you may use the mnemonic BP-DOC,
which means bleeding, pain, deformities, open wounds and crepitus.
Examination of the head, scalp and skull. Check for bleeding, pain, deformities, open injuries. For ears and nose, look for blood or cerebrospinal fluid, CSF, in or around openings. Pupils normally constrict with more light and dilate with less light. Abnormal findings include no reactivity to light, pupils that remain constricted, or unequal pupils. For mouth, check for bleeding, pain, deformities, and open injuries. Check for possible airway obstructions such as foreign objects, loose teeth, etc. Examination of the neck. Always go front to back, that is anterior to posterior. Check for bleeding, pain, deformities, open injuries, tenderness, and swelling. Check trachea for midline position. Observe jugular vein distension, that is JVD. Palpate vertebrae. Examination of the chest. Check for bleeding, pain, deformities, open injuries, crepitus, tenderness, and swelling. Feel ribs for deformities all the way to the spine. Palpate the sternum. Examination of the abdomen. Check for pain, rigidity, hardness, or distension, guarding. Cuts, scrapes, serrations and abrasions. Penetrating wounds, protruding organs, potential bleeding and infection. Examination of the pelvis. Possible. There could be possible spinal injury. For genital area, check for priapism in males. Palpate iliac crest, pelvic wings, and pubic bones. Penetrating injuries are possible. Look for wetness caused by incontinence or bleeding. Examination of the lower extremities. This is a common site of injury. Do not rush your examinations. Check for bleeding, pain, deformities, open injuries, crepitus, tenderness, and swelling. Check dorsalipedes pulse. Check for motion. Ask to wriggle toes. Check for sensation. Ask patient, can you feel this? Examination of the upper extremities. Check for bleeding, pain, deformities, open injuries, crepitus, tenderness, and swelling. Check radial pulse. Check for motion. Ask to wriggle fingers. Check for sensation. Ask patient, can you feel this? Examination of the back. Check chest wall for deformities that may indicate broken ribs. Check for obvious deformities and or tenderness along entire length of the spine that may indicate spinal cord injury. As with chest injuries, check for sucking wounds, penetrating injuries, cuts, etc. Blood accumulation in the flank sand or tenderness may indicate abdominal injury.